Hello everyone. So welcome to Dr. Tom. I am Govind Tomar and today we will talk about one of a clinical condition that is enlarged prostate, and we also call it as benign prostate hypertrophy or benign prostate hyperplasia. This condition is common among the men who are above 40. There are data which suggests that the men above 60 years, and in the 50 to 60% of the men above 60 years, they have enlarged prostate. Similarly, the men who are above 70 to 80 year of age, in them 80 to 90% of men, they have enlarged prostate. So what all we discuss in the today's session? Today we'll talk about the pathology of the enlarged prostate, that why the prostate increase in the size. What are the recommendations for enlarged prostate for those men who have enlarged prostate, or usually for the men above 40? We'll also talk about the symptoms. What are the symptoms associated with the prostate, hyperprostate, or benign hyperprostatic, or hyperprostate trophy, right? This is exactly. So as the name suggests, hypertrophy means when something increase in size, right? So I'll directly come above to the prostate. We'll start the discussion from the prostate, that what is prostate exactly and what is its function. Normally we'll talk about the function, and then we'll directly come to the what is the pathology. So that is a short lecture only. So we know that prostate, when we speak about prostate, so prostate is actually a gland, right? It is a gland. It is an exocrine gland. It is important that it is an exocrine gland, right? It is a single gland. It is a walnut shaped gland or chestnut shaped gland. So it is single chestnut shaped gland. It is a chestnut shaped gland, right? It's a big gland actually. So how it is located and where it is located? So it is located below the bladder and above the urethra. So we can say that it is in between bladder and the urethra. If I just try to show you where is that gland exactly, so just try to understand. Suppose this is the bladder. Say this is the bladder. If we just consider, and then this is a urethra which is passed on. So somewhere here, this is what we call as prostate. So this is how the prostatic gland is there. So I'm just drawing over it. So, but this is how the prostate is. It is a single gland. What is the function? We'll talk about the normal function. So we can understand like that. Suppose this is a urethra. This is urinogenital duct. Why I'm saying it is a urinogenital duct? Because urethra is a common passage for urine as well as sperm, right? And suppose this is what I'm saying. This is prostate gland. So this urethra is enclosed by this prostate gland like that. And what exactly happened? Suppose I just draw. Suppose this is a half part of the prostate. Just understand, right? Then from this prostate there are many prostatic duct. So these are the prostatic duct, and then these actually ducts open into the urethra directly. So that is how the prostatic secretions pour into the urethra, right? Now we need to understand, before we will exactly come to the pathology, we need to understand that what is the function of the prostate. Okay, so as I told you that it is a single chestnut shaped gland, right? It is a reproductive gland of the men. So it is a men reproductive gland. Let me show you exactly the male reproductive system, and then we'll talk about it more. So let us see the reproductive system of a man first, and then we'll talk about it more. So here it is a reproductive system for men. Now let me explain this diagram to you just in a brief, because of course we are not talking about reproductive system. The videos are already uploaded. So these are testes. So this is what it is, epididymis also. So this is epididymis. And this together it is called as testicle. So together epididymis along with the testis, we call it testicle. So what happens that in the testis the sperms are formed. Now these sperms go above with the help of this vas deferens. So this vas deferens is like a duct, right? It is a duct. This vas deferens then joins another duct that is called as seminal vesicle. Although this duct is a circular duct like that. So this is joined. Now this new duct, what we can see here, this is called as ejaculatory duct. If you really want to study about the structure of male reproductive system, then I have a video over there as well, from the name male reproductive system, so you can watch that as well. Well, so now this enters into urethra. So look at this duct, say this is ejaculatory duct, and this actually enters into urethra. So this opens into urethra like that. But because here it is covered by prostatic gland, so you can see here that we have the prostate, what I'm drawing with the black color. So this is, so this is why the connections are not visible. And here it is a prostate gland. Now the prostate gland, the secretions of the prostate gland, they also comes into urethra, and now in the urethra the prostatic secretions are come. So in the semen means, what is semen? So we have sperm from the testis, right? Then we have the seminal fluid, we have prostatic fluid, and we have one more gland. It is not in the diagram, but it is called Cowper's gland. So together they form semen. So if I talk about the composition of the semen, then there is a sperm, right? And there is a plus seminal fluid, or I should say seminal fluid plus prostatic fluid plus Cowper's fluid. So seminal fluid. So there is a seminal fluid plus prostatic fluid we have, right? Plus Cowper's fluid, I should say. So seminal fluid actually contributes 70% to the total amount of semen, what it is, 2.5 to 5 ml basically. Prostatic fluid contribute 10 to 13%, and same for the Cowper's, 10% around or 8 to 10%, and sperms are again 10%. The highest secretions in semen, that is of seminal fluid although, but here because we are talking about more on prostate, so we'll understand about the prostatic functions. So this is a diagrammatic representation, and then the semen ejaculate from the penis, right? So ultimately from the urethra, this is urinogenital duct, the semen comes out, and of course penis is a copulatory organ, and we have erectile tissues in the penis. That is why it undergoes erection. We'll talk more about it, but in another session. For now, let's come to the prostate again. So the main secretions of prostatic gland are, so what are the main secretions of prostatic gland? So the main secretions include actually citric acid, and here it is a pathology. If we understand from where the citric acid is coming, then it is easy to understand that what is exactly the pathology for benign prostate hypertrophy, right? So the secretion of the prostate, it is citric acid, main component. Apart from, so it is acidic, right? Apart from this, there is a bicarbonate ion, because overall pH of the semen is alkaline, so it is bicarbonate. There are some ions including zinc and calcium. So more of the discussion is today of that how zinc is helpful for the prostatic health. So we'll cover three things actually. In the today's lecture, we have discussed what are the secretions of prostate. Now you know it is one of the reproductive gland, and they help to nourish the semen, sperm. That is a one function. The secretions include citric acid, so citric acid activate the sperms. Calcium ion are anyways required. Similarly, zinc is anyways required. Bicarbonate give the alkalinity to the semen, right? Apart from this, that is a function of the prostate. The second thing, what will be the outcome for the today's lecture, is that you will come to know exactly that how zinc and prostatic health are related to each other, right? So zinc and prostatic health are actually related to each other. And the third thing, you will come to know that what is a pathology, and the fourth thing you come to know that what are the symptoms, right? Of course, treatment we are not going to discuss. We'll talk about the foods, what are good for the prostatic health, but not in today's lecture. Okay, so that is a basics about it. Let's now come to the prostate. What is the pathology of the prostatic hypertrophy, right? Let's talk about it. So here the discussion is on pathology of benign prostatic hypertrophy. One more thing, benign means something which is not dangerous. If you have an idea of cancer, then I'm sure you have heard something called cancer is of two types. One is benign and second is malignant at a very basic level. So malignant is that cancer which is very dangerous, which is spreadable, but benign is something which remains in a control, which is a specific to a particular reason only. So that is called as benign. So we can say that it is a kind of cancer. But make sure, even if prostatic hypertrophy is not treated till the time in a given period of a time, then it can cause the prostatic cancer. Yes, and it can also lead to the bladder cancer as well in men. So there are chances of having a cancer situation in men, above 40, if this condition appear and if it has remained untreated for a long period of time. That is why it is necessary, although the treatment is anyways required, because you will come to know exactly what are the symptoms. So treatment is anyways required, don't worry. But still, if untreated for a long period of time, because sometimes symptoms, it is not necessary that symptoms always arises, right? We'll talk about what are the symptoms, but it is not necessary always. So sometimes it remain undetectable or untreated, and it can lead to the cancer of the bladder and actual prostate cancer. But benign itself means a cancer, but benign means it is not that dangerous, right? Okay, so pathology we are going to discuss. Now, as I told you, that zinc is anyways required for the prostatic cell. That is the first thing what you need to understand for your entire career if you are talking about the prostatic health. Because what is the problem? I have heard so many lectures and about the prostate actually, but no one talks about that what is exactly the pathology. So that is why I thought, why not to come with that topic first of all. So let me tell you, zinc is required for prostatic cells, for prostatic cell to synthesize citric acid. So that is a major point, to synthesize citric acid. Because I told you the citric acid is one of the secretion of prostate. So we need to understand that how citric acid is coming, right? Citric acid. Okay, fine. This is important, right? So what exactly happened? Let's try to understand. Let us make a cell. So let us consider it is a cell, right? It is a prostatic cell. Just consider. And in the prostatic cell, what exactly happened? This is the mitochondria. So say this is a mitochondria. Correct? This is mitochondria. Now, of course, mitochondria has two membranes. Inner is folded. That is called cristae, and so. But of course, the discussion is not on that. What exactly happened? What exactly happened? That zinc is present inside the cytoplasm. So this is cytoplasm, and from the cytoplasm it enters into the mitochondria. So the important thing is that zinc enters into mitochondria of prostatic cell, Now before I'll come to the next part, I would like to talk to you two things, right? What is the two things? Let me now discuss. I'm sure you have heard, if you are a biology student or if you are a medical student, then you are aware that how a cell gets its energy, except RBC, because RBC do not have mitochondria. So how a usual cell gets its energy, right? So basically the glucose, it transform into the two molecules of pyruvic acid or pyruvate. So this is the process which is called as glycolysis. So this pyruvic acid then transform into acetyl coenzyme A, and this acetyl coenzyme A then enters into mitochondria, and this acetyl coenzyme A, it is a 3 carbon compound actually. Oh sorry, it's a 2 carbon compound, not 3. So it is a 2 carbon compound. Acetyl coenzyme A is a 2 carbon compound, right? So of course one pyruvic acid gives rise to one acetyl coenzyme A, right? So we are talking about from one acetyl coenzyme A, correct? Now this acetyl coenzyme A, it is a 2 carbon compound, and it is received by a 4 carbon compound called as oxaloacetic acid. So it is received by oxaloacetic acid, and oxaloacetic acid, it is a 4 carbon compound, right? Now this oxaloacetic acid, when it combines with the acetyl coenzyme A, so again a 4 carbon compound is combining with the 2 carbon compound, so we have a 6 carbon compound that is called as citrate. I'm sure you are getting exactly where I'm trying to come. And the enzyme which is required here, it is citric, or rather citrate synthetase. So the enzyme is citrate synthetase. and that is how the citrate is formed. Now further, this citrate is converted into isocitric acid or isocitrate or isocitric acid. Here an enzyme which is required, that is called as aconitase. So the enzyme which is required, it is aconitase, or wait. So the enzyme is aconitase, and here it is important, aconitase, and this is also known as citrate isomerase. Citrate isomerase. This enzyme is also called as citrate isomerase. So now we have this isocitric acid. This is again a 6-carbon compound. So citrate is a 6-carbon compound. Then there is a long chain of reaction that the citrate transform into isocitric acid. This isocitric acid is then transformed into alpha ketoglutric acid. That is a 5-carbon compound. So if I'm writing here that it is a alpha ketoglutric acid or glutrate or glutric acid, and because it is a 5-carbon compound and citric acid is a 6-carbon compound, so one carbon is lost in the form of a carbon dioxide, and because it is a redox reaction, so one NAD is reduced into NADH2. But of course we are not discussing the citric acid cycle. I only mean to explain to you that how the citric acid is formed, or the citrate is how it is forming. So that is what my aim. All I was trying to tell you is that in the prostatic cell, in the mitochondria, that citric acid cycle is going on, and over there citrate is synthesized. Now because prostate has a function to make more and more citrate and to release into cytoplasm, so what it do, it asks zinc. So what exactly happened, I told you in the beginning that zinc enters. So what exactly happens, let me tell you, wait. So what exactly happened here, the zinc enters. So zinc enter, this zinc inhibits this aconitase enzyme, and here it is a complete pathology. If you can be for 2 minutes more with me, you can understand the entire pathology. So this zinc ion which is now present into the mitochondria, that actually inhibits aconitase, and once aconitase is inhibited, there is no further conversion of the citrate into isocitrate, right? And now you can understand, if citrate is not converting into isocitrate, so coming back to the last diagram, so here what we have exactly, we have a lot and lot citrate, and that lot amount of the citrate, it is then comes into the cytoplasm. So that is how I told you in the last, I think, topic, that that citric acid synthesized by prostate. So this is how exactly citric acid comes into the prostatic cell, and when citric acid is in much more quantity, then it is released into the cytoplasm of the prostatic cell, and that is how it becomes the part of this prostatic secretion, and that is how the zinc as well. So zinc also comes into the prostatic secretion. So that is exactly the mechanism, that how citrate is produced. This is important. So what exactly happened, the zinc which is there, it inhibits the conversion of citric acid into the isocitrate, thereby increase the amount of the citrate within the mitochondria, and that increased amount of the citrate is then released into the cytoplasm of the prostatic cell, and thereby it comes into the secretion, right? Now one more thing I have to edit here, over the prostatic gland, so there is a capsule which is present, so that is called prostatic capsule. So prostate capsule means a fibrous layer, so there is a prostatic capsule which is also present here, correct? Now what this prostatic capsule do, this prostatic capsules make sure that prostate would not enlarge anymore, or of course it keep tighted. So suppose I have this mobile, just say I have this, wait, so say I have this mobile, so I have this cover as well, right? So if I just put this cover like that, so what this cover is ensuring, that it remain it keep my mobile safe and it basically intact my mobile. Similarly, on the prostate we have a fibrous capsule. That is something which also you need to know. Now coming exactly how the prostate is increased. If you can understand, I told you in the beginning that the lecture would be on zinc more. So now you know that zinc is anyways required for the prostatic cell. Now what is exactly the pathology? So I'm writing in few words that if anyhow there is a deficiency of the zinc. So suppose if there is a deficiency of the zinc occur, that means citrate is no more inhibited, or rather not citrate, exactly aconitase I should say. So aconitase is no more inhibited. If aconitase is no more inhibited, then what would happen? This citrate or citrate is converted into isocitrate. This conversion remain continue, and of course the enzyme is participating here, that is aconitase, because earlier what was happening, that this aconitase was inhibited by the zinc, but now zinc is not available to the cell, say anyhow due to any deficiency. I'll let you know what can be the possible reasons. So the isocitrate would be formed. This isocitrate will then continue the Krebs cycle, exactly I'm writing this, and the result of the Krebs cycle is ATP. So the result is ATP, FADH2, NADH2. And because you are enough intelligent to understand that these NADH2 and FADH2, they are act like a check, so they now undergoes to the electron transport chain and they will release energy again. So FADH2 give raise to 1.5 ATP and NADH2 give in future, that is 2.5 ATP. So all I'm trying to say, now prostatic cell is very happy. Why prostatic cell is very happy? Because prostatic cell is getting too much amount of energy, or more and more amount of energy, in absence of zinc. Now it is a behavior actually. Whoever get the energy become dominant. So similarly, when prostatic cells get energy, they start to divide. And when they start to divide, you need to understand, because they are actually getting now energy. Now they have energy, they can divide. And because they are divide, now the division would takes place toward inside only, because you are understanding, I told you, suppose this is a prostate, outer layer it has a capsule, fibrous capsule layer, so it can't grow outward, the only growth takes place toward the inside. So this is the prostate, suppose, then this prostate grows inside, and what is inside? We have urethra which is passing through the prostate. And what happens? So now the prostate become, or rather the urethra constrict. So let me tell you, this energy which is required, so this causes cell division. Yes, it is, we can, and excessive cell division is a cancer, nothing else, but it is cancer, but it is benign. So one more reason, now you can say, hey man, that means if we are giving more energy, then does that mean that a cell become cancerous? Not like that. It's a behavior of the prostatic cell, exactly. So every cell has its different behavior. Cancer has different reasons. Of course, we'll talk more when we talk about the cancers, but for now you need to understand that this is an increased amount of energy, that causes proliferation of the prostatic cell, and here such kind of situations comes in. So this is, now you can see, the prostate can't grow outward. This prostate is growing toward the inside only. So because it is growing toward the inside, the prostate become, or rather the urethra becomes so much narrower. Now you can relate the symptoms, that whatever the urine is here, it is difficult for the patient to pass to this urine, right? So that is one thing you need to understand. Let me check if I have covered the things. So yes, I think we have covered how exactly deficiency of zinc causes the benign prostate hypertrophy. So you need to understand that why prostate increase in size and why it is not growing outward, why it is growing inward, because outward we have the prostatic capsules, right? So it is almost 24 minutes. So I think I have to wrap up it soon. So let me talk a few more things and then we'll wrap up, So this is, now you can see exactly the prostatic gland, or the prostate is increasing toward the inside. Good. So what can be the symptoms? Now listen to the symptoms. So symptoms are very unique. So a patient having the benign prostate hypertrophy or benign prostate hyperplasia, now you can think the patient is urged to for the urination, but the moment patient try to urinate, the urine comes in the form of drops, because only drops and comes, because you can see here the urethra is completely, what I'm saying, it is constricted. So because urethra is constricted, the continuous urine flow is inhibited. Because of that. So let me write the symptoms first, that what is the symptoms, or let me write it here, the symptoms. Okay. So they are actually more urinary tract symptoms. So symptoms are urinary tract symptoms. So first is weak urine flow. Urine comes as drop, in form of few drop. Because of the continuous urine flow or urine retention, so there is an urge to urination. Even patient urinate, he has urge for urination, right? Because still the good amount of urine has remain filled in the bladder, so urge for urination, so urge for urination. Apart from this, there is a complete or partial urine retention. So urine retention in the bladder, and because of urine retention there can be irritation, right? There can be irritation, right? And apart from this, all we need to understand that these are some symptoms, hesitation, and then so these are some of the symptoms which are associated with that. Okay, we need to understand. Apart from this, there is one more problem that is called as nocturia. So what is a nocturia? So leaking of the urine at night. So urine flow at night, of course involuntary, urine flow at night, because you can understand the pressure is too much, urine flow at night. Okay, and involuntary flow of urine, so we can say involuntary or release of urine, and of course it is involuntary. Because again, why I'm saying involuntary, you need to understand, because the pressure is too high, that is important, right? So this is important. Apart from this, there is some painful urination. So these can be some of the symptoms. So usually these are urinary tract symptoms. And let's now talk few things that where these symptoms are common, or where the enlarged prostate is seen commonly. So it is found that in person above 60 years of age, it is found that around 50 to 60% of the people who have enlarged prostate, and this percentage increases up to 80 to 90%, same enlarged prostate above 70 to 80 years of age of men. So men of 70 to 80 years of age, they have 80 to 90%, out of them have 80 to 90%, they have enlarged prostate. So that is also important to understand, right? Okay. Now the one question is here is that what are the men who are more susceptible for this problem? So let's now talk about, so we can say some of the recommendations, actually we can say there are some recommendations for the men above 40. So usually the men who are above 40, they need to understand that zinc levels should be proper. Okay, so they should have a diet adequate with the zinc. I'm sure some of you may ask now, so tell us the diet. So diet, you know, so I should say educate diet. Okay, so educate diet with zinc. That is also important, right? It is suggested that, of course, that do not take zinc more than 80 milligrams. So do not take zinc if even if someone is taking supplement. Okay, on a daily basis I'm talking about. So dietary requirement even. So do not take zinc more than 80 milligrams. So that can cause further problems. And secondly, these levels, so up to 80 milligram of zinc is good for eye as well. So zinc has two roles in the prostatic health as well as in the eye health, right? So do not take zinc more than 80 milligram, sorry, more than 80 milligram. So that is also important, right? And how to take the zinc? So if zinc is available in amino acid bound form, so if zinc is available in, if zinc is available in amino acid bound form, so if zinc is available in AA bound form, ZNAA form, is it is most utilizable. The thing is that this amino acid bind zinc, or this amino acid bound zinc, can easily accepted by cells, or can easily cross the, what we say, channels accepted by cells. So there are actually zinc channels as well. So with the help of these zinc channel, the zinc enters into the cell. So this is important. Okay, so that is a recommendation. So having a good zinc diet. Now a question comes, look, zinc is available in plenty of foods, right? There are many foods, but zinc is more available in more animal sources, right? In our country, like in India, and so I have a limit of pages. Just give me a minute. Let me increase the pages count. Okay, so we have actually page limit over there, and that was finished. Okay, let's now continue with that. So we were talking about the recommendation. So I was saying, like a country like, of course, our country, my country, India. So I myself is a vegetarian, a pure vegetarian, and there are people who are vegetarian, and in the vegetable sources such as, whole grain cereals, bread, legumes, and other vegetarian food, there is a phytic acid actually. So phytic acid, it is present in the vegetable sources, such as cereals, legumes, pulses. So that is what I'm trying to say, in whole grains, right? So this phytic acid actually, it bound to zinc. It bounds to zinc in the food, from the food, right? It bound to zinc usually, and decreases GIT absorption. So in food, in vegetarian sources like cereals, legumes, so there is phytic acid. So this bound to zinc, and this decreased GIT absorption. So the suggestion is that the one who are completely vegetarian, they need to double the sources of their zinc, right? So they can, although they can do one thing, they can increase uh, their zinc source up to 50%, right? But yes, if they are taking supplement, then make sure the supplement should not exceed 80 milligram per a day. Okay, so this is something which is also very, very important. So this is, and then of course, so this phytic acid bound to zinc and decrease the bioavailability of zinc into the GIT, and hence decreases its absorption. So there are more chances of the prostatic enlarged prostate in vegetarian, because the animal sources are rich in zinc. So about the food, that what food are good for the, prostatic health, we'll talk in the next session. Okay, so this is important. So that is why I told you that requirement of the dietary zinc may be as much as 50% greater for individual of vegetarian diet. That is important. So can be there any other factor, like which is responsible for the decrease zinc absorption. So one of the factors is a phytic acid. Can be there any other factors? So yes, other factors. So above 40 mins, so usually either they are taking some kind of drugs, suppose if they have some any other problem as well. So sometimes what happens, there are other sources which we are taking in, they also reduce the absorption of zinc. One such drug is omeprazole. So one such drug is omeprazole. So omeprazole is used to treat, so it is used to treat GERD, you know so gastroesophageal, reflex disorder. So it stands for gastroesophageal, reflex disorder, or kind of constipation, uh, you know or some reflexes, acid reflexes. So that is so used to treat that omeprazole. And it is found that in 16 to 50%, so it causes in 16 to 50% of patient, this omeprazole, it develops zinc deficiency within 2 months of starting of omeprazole. So it result into deficiency of zinc within 2 months of omeprazole starting, so this causes this also, omeprazole we are talking about. Similarly, we have many chelating agent, so chelating agent, of course, if you are from medical background, you know what is chelating agent. So that which bound to metals, and yes, zinc is one of the metal as well. So that also decreases the absorption of the zinc. Last but not least, let's talk why zinc level are low in men above 40. So first is that with age may possible that the absorption is reduced by GIT, can be the first cause. I mean to say, why zinc is reduced in people. So first can be reduced absorption of zinc by GIT. The second could be some lifestyle changes. Then there could be increased likelihood of disease that affect zinc level. So there can be some of the disorders that affect the zinc absorption, that affect the zinc presence in the body or zinc level. Severe diarrhea is there. So along with body fluids, zinc also, ions also comes out. And of course drugs such as omeprazole and chelating agent, so they causes zinc inhibiting. So that was a discussion, everyone. So what is the topic? The topic is that zinc in the prostate health, right? Zinc is essential for the prostate health, and prostate is important for us, for the men. So the men above 40, they need to take care of their prostate. So that is important. So I'm sure you like this, clinical discussion. If you really like this, it's the first time asking for, do subscribe and do like, and definitely tell me what other clinical topics you want. And of course, it's just starting, right? So we will be continuing with the clinical topics, but the channel is more toward the school syllabus, more toward the NEET syllabus. So let's now continue with that clinical topics as well. Hope you enjoy that. We'll see you now in the next session like that. So in the next session, I will make sure that I will be coming up with the food product that are good for the prostatic health. So till then, have a good day and goodbye.